Now we're going to move on with the further investigations in this particular region. How can we further enhance our definitive diagnosis and what exactly we're dealing with in a particular patient? For that, we have to carry on with the radio imaging techniques that we have. For instance, we can resort to the CT scans as well as the MRIs. Now, looking at these CT scans and MRIs, just having a normal look, we just have to look at the spaces over here. And we would be basically featuring the infundibular stalk over here. Now, the deviation of the infundibular stalk has to be seen. If there is a mass deviation, and it's basically is going to be a contralateral deviation. The mass is going to be present on the opposite side and the deviation is going to be on the, for instance, if it's a right deviation, the mass is going to be present on the left side. And if it's a left deviation, the mass is going to be present on the right side. So it's basically a vice versa situation. And even we're going to look at the anterior lobe and the posterior lobe. The masses in the posterior lobe, they appear to be quite brighter due to the fat releasing hormones that are present over there, and the anterior pituitary masses are much not that brighter in comparison to the posterior pituitary masses. So we have to look at these features, and then obviously the cavernous sinuses, if they can be appreciated, we're going to look at that. And we can basically have the coronal sections as well as we can resort to the axial sections. There is going to be a sufficient amount of exposure, symmetric kind of radio imaging techniques are going to be used, and thin slicing. For instance, it has to be almost a 3 to 5 millimeter slicing technique has to be used because we're dealing with a very small particular lesion in that particular area. So it has to be quite a thin sliced CT scans and MRIs in this particular case. For instance, when you look at this particular picture, you're going to see that there are the important structures that are passing on laterally in this particular area. We have the third, the fourth, and the sixth cranial nerves that are passing on in the cavernous sinuses. So you are going to look at the cavernous shadows as well. The clinoid shadows that are present anteriorly as well as posteriorly, they're going to be appreciated on the MRIs. And then the concavity of the pituitary gland. So as you can see, there is a convexity that is shown over here. In normal MRIs, we're going to see that there is a concavity that is shown. If there is a bulging convexity, as you can even appreciate over here, it's basically pointing out towards the fact that there is some sort of a mass. May it be an adenoma, may it be a cystic lesion, a fluid collection, may it be an inflammatory condition. Whatever the case is, the mass is present, which is resorting to the particular kind of pressurized symptoms on the neighboring structures as well. So this has to be kept in mind when you carry out the CT scans and the MRIs. And of course, you have to remember the basic anatomical features that are present in this particular area. Contrast injection is also quite importantly seen over here. It has to be a homogeneous kind of a mass that is present over there, just to identify whether it's a pituitary adenoma or not. So this kind of techniques are basically the main resorts over here, and it's also going to be very helpful for you when you are basically planning a transsphenoidal surgery for the patient. You must know what kind of an approach you're going to take to basically resect the mass out. So it's going to be very helpful for you in this regard as well.